Thank you, Acting Speaker, and I rise to speak on the Public Health and Wellbeing Amendment State of Emergency Extension Bill 2021. And in its current form, I won't be supporting the bill, but I do commend the amendments to the bill, and if they are passed, then that will change things from a support perspective from me. The reason I don't support the bill is because the government is asking for an extension of the state of emergency till the end of the year. Now, we've been in a pandemic for nearly a year now, and we are told that we have reached COVID normal. So I find it a bit of an oxymoron that we're in COVID normal and requiring a state of emergency to be extended. Now, I come to the Parliament this week when we were in stage 4 lockdowns in regional Victoria. And during early last year, when we were at the first stages of the pandemic, I was unable to come to Parliament when we were in stage 3. Then the government changed their minds around the health advice because they wanted to pass the state of emergency bill, the omnibus bill. This year again, stage 4, worse restrictions never experienced in regional Victoria, but I'm allowed to come down to Melbourne to suit the government's agenda. Now, my statement here is the government has had enough time to put in place fit-for-purpose legislation around hotel quarantine and any other areas that there is gaps during that period last year, so that they are ready to continue to put the necessary restrictions and regulations in place to make sure we manage the pandemic. People of Victoria have done an extraordinary job. People of Victoria have done what they've been asked to do. They have cooperated. They have managed the pandemic very, very well. The government have not. What we've seen is clear evidence that hotel quarantine has failed, not once, but twice. We've just come out of our 3rd lockdown. The 2nd lockdown was purely and utterly caused by failures in hotel quarantine and contact tracing. Now, over 800 people died as a result of hotel quarantine failures. And hotel quarantine has been run in other states successfully. There have been outbreaks and there's been breakdowns, but they've managed them without going into the lockdowns we saw for 5 days last week and this week. And we've seen, particularly in New South Wales, where they've been managing hotel quarantine for most of last year and put about 125,000 people through the system. And we here in Victoria, in a matter of weeks, have only put just over 35,000 people through hotel quarantine, and it's broken down again. So what's clear and evident here is the processes are not in place. I can't see the point in the conversation being around whether a nebuliser should have been allowed or was allowed, or the nebuliser man, as he's now called, being the scapegoat. The conversation is about the processes. Infection control is not a new concept. I worked in the 80s in infectious areas using techniques called barrier nursing, where you don and you doff and you have infectious patients and you must make sure you don't cross-infect with the other patients in the ward. My mother worked at Fairfield in the 50s, in Fairfield Infectious Diseases Hospital. We have been managing viruses and infections for years. This virus is a virus. It is wildly infectious, so are all viruses. It is difficult, but we have the processes in place in hospitals to manage that. Now, I am amazed that hotel quarantine is managed by people without infection control qualifications. We have learned as a society in health that you do not wait till the problem occurs. You do preventative measures and preventative medicine. So to have the hot hotels managed by Alfred Health is brilliant. But to have the hotels where the risk is still high, managed by Degeter and the names, of all the different departments, Department of Jobs and Precincts. And I recall that video that was put together by the people in those departments saying, congratulations to us. We've done a really good job. It was embarrassing. I'm so sick of hearing this government congratulating themselves. Martin, you were part of that. You must have been horrified. Hotel quarantine was breaking down when that video was being put together to say, we've never done anything like this before. Look at us, aren't we amazing? It's been a logistical, incredible event for us to put together. Well, no, I'm sorry. I ask you, what was the motivation behind this government to use private security? Don't talk to me about a pandemic needing to be managed professionally by health experts, because there weren't health experts. The AMA have been crying out for their advice to be listened to. So I'm sorry. Extending the state of emergency bill is not what we need to be doing here in the parliament. We need to make sure we have monthly parliamentary sittings at least to keep oversight in place, because what we've seen is a government without oversight who gets a gang of 8 around them and doesn't actually give us the data and evidence. The Shadow Minister for Health in the other house, in the other place, an experienced health professional, a very qualified health professional. She's a diabetic educator, midwife, registered nurse, years of experience. You know what? She can understand the language that's used. I know when we nurses start talking about cholelithiasis and islets of Langerhans and whatever other words you probably have never heard of, we do speak another language. I understand that. But my point is, we do understand the language. So why is the evidence that we hear about from the Premier around the health evidence and data so secret? Why are the opposition, whose job it is to scrutinise government, that's our role, why is that evidence and data secret? So if you're not playing politics and you really do want to get on with managing a pandemic, because as an island country, we've known that's our advantage for a long time, and biosecurity in the agricultural community has been something we've been very proud of. Pandemic planning, something we've all done in all the departments and all industries for years, who are exporters, like the dairy industry that I was part of and very much part of pandemic planning. So don't say we're not prepared. That's your problem. Be honest. The process is broken down in hotel quarantine and contact tracing, and they're still broken. Fix those. Use the offer of our help. Give us the evidence and the data, and stop the secrecy and the game playing and then accusing us of playing politics, because that's actually not true. As I say, the errors in hotel quarantine and contact tracing to this minute are alarming, and over 800 people have died. Not 56 like in New South Wales, and this is not California and it is not the UK. We are here in Australia, and every state is managing it so much better than Victoria. I think the real kick in the guts to Victorians was, however, when the tennis people were called essential or deemed as essential workers, essential. There are families out there whose loved ones, just the other day I heard of a lady whose husband couldn't be with her when she passed away, holding her rosary beads in her hand, her 7 children stuck up in Warrnambool. She was dying alone here in Melbourne with her husband of 65 years not able to be beside her. Those are the stories that we need to focus on. The families who run businesses, who are really doing it hard, can't pay the wages, let alone pay themselves. The sole traders who have been completely ignored. Let's just fess up, Labor, that you've stuffed up hotel quarantine, and that's where these deaths have actually eventuated from. And now you've done it again, and we've just been through another 5-day lockdown in the country as well. There's better ways of doing this, and you know it. Get the teams involved, like the health professionals, AMA, and get on with doing your job, not extending the state of emergency bill.